Hi, my name is Shane Lashley, and I'm the clinic director at the Environmental Brain Health Clinics of America in Plano, Texas, just outside of Dallas. But perhaps most important for this conversation, I also have a mold or biotoxin-related illness, often referred to as CIRS, CIRS, which means chronic inflammatory response syndrome. About 25% of the human population is genetically vulnerable to this condition, but actually it's something that anybody can acquire if they have the proper exposure. And it affects all aspects of life, or it can, and it can be very, very disruptive. And there's a lot of conflicting information in the world about it, in the internet, everywhere else. So I wanted to actually provide people with a way to get the leading information from the number one active licensed physician who's taught over 400 healthcare providers in the only program that is accredited by a major medical university on this topic. This is a first of its kind. It's the most comprehensive collection of research on the topic in the world, and it's the leading research, leading minds teaching the next generation of healthcare providers. So the obvious question would be, what if that doctor could help shed light on the topics you're facing today? And that was the idea behind Truth and Trust and the Truth and Trust video series with Dr. Andrew Heyman and Dr. Michelle. So I would encourage you to take a look at this program. If you are looking around and saying, gosh, I may have been exposed to mold, or I may have a biotoxin-related illness. I don't know if I have CIRS, maybe I do. You want to figure all that out. There are questions that you're likely struggling with that we are familiar with because A, all three of us are patients, and B, we've all been in this space for a while. These two doctors represent thousands of patients' conversations, so they understand the kinds of things you're contending with and the ways to help you think them through. This is a fantastic resource if you're trying to communicate with a loved one, like a spouse or a partner, a coworker, a caregiver, a friend, and you're just trying to make your own decisions about your own care. This is intended to empower you with information that you might not be able to get anywhere else, and it's coming from the leading scientific sources in the space. And there's no other source that's as authoritative as Dr. Andrew Heyman in this video series. Now, what I would encourage you to do is take a look at this in whatever way you would like to do it, but these are video vignettes. So you can pick a question at a time. They're only 10 or 20 minutes a piece in most cases, if you're a little shorter, if you're a little longer, but there's short conversations about a specific topic. So you can get in, watch the topic that matters to you, come back to the others later, and you can do them in any order. You do not need to be a patient at our clinic, and you do not have to become a patient at our clinic. This is for anybody, anywhere with these issues or these questions, and you just want the information, and that's okay. Now, if you would like to talk to us about our services at the Environmental Brain Health Clinics of America, you're welcome to do that. In fact, if you watch videos 1, 7, 8, and 16, we'll actually give you a complimentary 60-minute conversation. So that's 82 minutes of information from Dr. Heyman and Dr. Michelle, and it's 60 minutes of somebody from our staff talking about those situations or those topics in your situation. So that's the actually best value for your money if you want to do that. But we have a community on the inside we're building, and Dr. Michelle and I meet with that community twice a month live. So if you'd like to be a part of an informed and empowered community on biotoxin-related illness, you'd like to have access to the leading thoughts on the way the medicine is going and the lifestyle issues that are affecting it, and you'd like to potentially be a part of that community, we'd love to have you. Please feel free to look at these questions and see if they pertain to what you're going through. And if they do, I strongly recommend this kind of information before you make big decisions. We'll see you on the inside. Thanks a lot. Take care.